Hey you guys, my name is Lydia Cervantes and I'm a senior here in the nursing department at Calvin University. I'm just so excited because today I'm going to take you on a little tour of our lab and simulation spaces here in the beautiful science building. In here we have one of our high fidelity mannequins. His name is Art. Hi Art, how are you doing?
I'm alright.
So what's awesome about our high fidelity mannequins is we are actually able to change their clinical situation, and that will present itself on this screen back here. So we can put them in a multitude of scenarios and those will all show up here. What's great about our high fidelity and standardized dummies is that we can create a multitude of clinical scenarios. Injection pad to practice giving injections. These pumps that are running right over here, we call them IV poles. They actually function real time and well. They go straight to the dummy. We are able to program them to run any sort of medication or normal saline to our patients, which again gives nursing students that hands-on practice that is so valuable. Another great tool that we use here at Calvin is these smart stethoscopes. These allow us to be able to listen on the real person we're practicing with and help us gain more experience in working with what that sounds like. And over here we have Brianna. Super exciting. One of our professors worked very hard to create a labor and delivery scenario. Students are able to practice as a labor and delivery nurse. What's amazing about the nursing program here at Calvin is that we are able to interact with tools like these to assess them, to understand how we as nurses are supposed to care for them appropriately and how we are supposed to manage them as well to protect our patients and to better their health, which is amazing. This is what it looks like for our professor to watch us in the clinical scenario. They all have audio that they will receive to this headset. Again, they can voice in here with this mic. This is another one of our simulation spaces. Right now it's set up to be sort of a school nurse's office. And you'll see we have her over here. I was told actually that the juniors were able to read a blood pressure on her. Crazy amazing stuff you should not be able to do on a mannequin. My mind is blown. I don't know about yours. Another great thing, as juniors, we begin our IV starts. Super nerve-wracking as a skill. You know, you're coming at someone with a needle and you're like, I'm gonna get this IV in you, like, for your medication, it's really important. Your patient's like, I hate needles. What's great is we get to practice that skill here too before we get to the clinical setting. These are things we will use on the daily. These are skills that we are to be very familiar with as nurses. So it is great that we can get the hands-on opportunity here in lab and here in simulation to be able to practice with them before we get to that clinical space.